Now you know what MS is and who is most likely to get it. But how do you know for sure when you have MS? Often, early symptoms are mild and may mimic other problems. They may disappear for years. Neurologic and laboratory tests may be normal then, which makes it difficult to diagnose MS definitively.
The week before my legs went numb, I was homesick. I was just really tired. I've never felt like that before. It was almost like having the flu. And I woke up one morning and I couldn't feel my legs or my feet. It was like pins and needles.
Well, it started with the burning in my lip, and that spread. And then that was the time that I got my diagnosis.
When I was first diagnosed, I ended up in the hospital, and that was in 1988, and suffered an acute attack. Ended up actually in the hospital for 2 weeks, and it was vision sort of coordination, and just feeling really rough.
What doctors are looking for in order to make a definite clinical diagnosis is evidence of involvement over time, dissemination in time, and symptoms or signs occurring in multiple areas, dissemination of space, of the central nervous system. Some of the different diagnostic tools or methods used are the MRI, lumbar puncture, and evoked potentials. Although a number of tests are available, no test is singularly diagnostic. The MRI provides clear evidence of white matter lesions in the central nervous system. The MRI is effective in making a diagnosis, but not necessarily the prognosis. There must also be clinical correlation to support the MRI findings.
So this is a picture of an MRI, and I'll just orient you to it. These are slices that are made like this through the brain. So this is the face. These are the eyes here, the nose here. This is the back of the head. And on this image, the areas that are affected by MS appear bright or white. And so these areas appear white against the background. And these are areas that have been affected by MS, by inflammation from MS.
The lumbar puncture is also known as a spinal tap. It provides a chemical analysis of cerebrospinal fluid and can help confirm a diagnosis. Evoked potential tests are recordings of the nervous system's electrical response time to the stimulation of specific sensory pathways, such as visual, auditory, or sensory. Healthcare professionals know how long a message should take to get to the brain. In individuals who have MS, the response times are usually slower because of short-circuiting or demyelination.
They did an MRI and they found lesions on my brain and on my spine, and it was really scary at first. They thought it was a tumor or cancer, so more tests were ordered and it was determined it was MS. So from there we had a spinal tap.